Let's welcome Daniel Zlott, a pharmacist and senior vice president of the American Pharmacists Association. And we're dealing with the hot topic of prescription drug coverage plans and what to do if you're impacted by a coverage gap in that plan. So welcome to the show. And what role do you play in educating patients and caregivers about the complexities, which there are a lot, of prescription drug coverage plans?
Hi, Mike. It's a pleasure to be with you. Thank you so much for having me. I like to think of it this way. When it comes to getting the most from your medications, your pharmacist is really your best friend. So as a pharmacist, I help patients understand their medications, what they're for, how to take them safely and effectively, and what to expect while taking their medications. Additionally, as you mentioned, I help patients navigate the complexity of prescription drug coverage. And for patients who may need some assistance affording their medications, I play a big role in helping lower the out-of-pocket costs for them when they come to pick up their prescriptions as well.
Yeah, and I talk to folks, there's a lot of stress out there when it comes to these prescription drugs, the costs. So tell us about some of the obstacles our seniors do face when it comes to managing their health and what you've seen and the cost of prescription drugs. Of course, what happens when they increase unexpectedly due to coverage gaps?
Yeah, great question, Mike. So let's just call it what it is. Insurance coverage and prescription drug coverage can be complex and confusing. It's interesting when you look at the cost of the out-of-pocket cost for prescription drugs, that's been increasing steadily over the last several years. However, the actual cost of the drugs themselves has been holding steady. This is mainly due to changes in the way that health insurance plans are designed. So we at the American Pharmacists Association, along with pharmacists everywhere, are working hard to address some of these unfortunate consequences, including increased prescription costs for patients. Now, many patients are enrolled in healthcare plans that include these coverage gaps that you mentioned.
Right.
And that includes both Medicare Part D as well as commercial insurance plans. When a patient enters one of these coverage gaps, they can face sudden and unexpected increases that in the out-of-pocket costs that they're paying for their prescription drugs. And that can sometimes make it difficult for patients to afford their medications when they come to the pharmacy counter.
Very good. And you're clearing things up for us, doctor. Thank you. And let's explain more about what a coverage gap actually is and what causes it and how seniors and their caregivers can navigate a coverage gap.
Yeah, absolutely. So coverage gaps are one of the most confusing parts about insurance. And so a coverage gap is when a patient reaches the maximum amount that their insurance plan will pay for prescription drug coverage in a given year. And unless patients are taking careful time to note when their coverage gap starts and tracking how much their prescription plan has paid for their prescriptions year to date, it's very easy to get caught off guard when they enter one of these prescription coverage gaps. Now, especially if you're in one of those gaps and you're having trouble affording your medications, one of the things I tell my patients is not to despair. Come talk to me as a pharmacist. I'm your best friend in terms of helping you identify what options may be available to help lower your out-of-pocket costs.
What is the danger associated with skipping or not taking the recommended dosage of a blood thinner medication? So folks said, well, I better skip so I can get by. What's the danger in that?
Yeah, this is always one of my biggest fears as a pharmacist when a patient is having difficulty affording their medications. So when you don't take your medications exactly as prescribed, especially blood thinners, that can put you at significantly increased risk of blood clots, which then increases your risk of heart attack or stroke. And obviously, that's not something anyone wants to experience. So if you're having trouble, talk to your pharmacist. Again, they can point you in the direction of resources that may be available to help you.
Good information. And are there options to help lower the cost of prescription medications?
Yes, for many patients, there are. Now, for each patient, the solution will be slightly different. Just like medical therapy has to be tailored for each individual patient, the options for helping patients lower their prescription drug costs also need to be tailored for each individual patient. So let's go back to that example of a patient who's on a blood thinner. In addition to talking to your pharmacist, another great resource is feelingwhen.com. If you have hit one of those prescription drug coverage gaps and you're on a blood thinner and you're having trouble affording your medication, this is a wonderful resource for patients and caregivers that may point you in the direction of some tools that can help you lower your out-of-pocket costs.
Great information, doctor. And one more time, where can folks go for more information to put this all together?
Definitely. So I'm going to sound like a broken record, but the first place to go is to talk to your pharmacist. They're really going to have the best information for you. And again, for patients who are on blood thinners, check out feelingwhen.com, a wonderful resource to see if there's options to help lower your out-of-pocket costs for your blood thinner medications.
Thank you. Hopefully that helps a lot of folks out there, reduce some of the stress. And yeah, take care of yourself. You can't be skipping these medications. And of course, for much more on this, head to our website, firstcoastliving.net.